SCA Characteristic 5. Because of our low self-esteem, we used sex to feel validated and complete. For most of us, our compulsive behavior and its anesthetic qualities served as a way to shield us from feelings of shame and low self-esteem. Although individual circumstances varied, the source of our pain included family shaming, sexual abuse, secrecy, emotional exploitation, isolation, or rejection by the very people we expected to support us. The message we received from these experiences told us that we were somehow defective and not worthy of love. Some of us learned that we were unforgivable and incomplete, with little or no value as human beings. In some cases, we were worthy only if we suppressed our emotions or performed sexually. Others may have manipulated us, convincing us that our value was conditional. The message was clear. We were judged and found wanting. We discovered power and pleasure in manipulative seduction, sexual prowess, and our growing list of conquests in our search for esteem. We soon discovered that sex provided a short reprieve from our low self-esteem by allowing us to feel powerful. This short-term strategy worked well to convince others to validate us, even if it was only as a sexual object. When we experienced rejection, this strategy fell apart, reinforcing our worst feelings about ourselves. Our lives often seemed empty, except when we thought about, sought out, or had sex. We sought attention in sexual situations, or, conversely, retreated into a world of fantasy and isolation. Emotional scars from our upbringing compounded feelings of unworthiness, and we sought to fill the void where our self-esteem should have been. Many of us shied away from friendships or relationships altogether because contact with our peers threatened us. We were sure that others could see our lack of value. We felt intensely lonely, often left out, ignored, or even excluded completely. Besides physical contact, we avoided being close to others because we were afraid to be vulnerable or uncomfortable. This pattern presented a significant barrier to intimacy. Instead, some of us engaged in empty, meaningless sex that reinforced our core belief about ourselves as undeserving of love and respect, or as a substitute for real intimacy. We tried hard to be attractive to strangers, spending considerable time, energy, and money trying to make ourselves look desirable. We often abandoned our sense of self and objectified ourselves, ceding all power to others. We became people pleasers, often compromising our integrity or dignity to maintain a connection. The validation we received from being physically desired allowed us to feel we had real worth, however briefly. We rarely had sex with anyone for reasons of mutual liking or respect. It was primarily about the affirmation we received, and we could never get enough. Most of us believed our self-worth depended on our ability to please others sexually. Sex for us was serious business. Sex gave us a temporary euphoria, a false sense of satisfaction. However, after the effects wore off, the shame around our behaviors compounded our feelings of low self-worth. Our search for someone who would validate us and make us whole became all the more desperate. This pattern stopped providing any lasting relief to our feeling of being less than. Afterward, we usually felt a heightened sense of shame for acting out, which affirmed our degradation. When these feelings intensified, we eventually went back for the quick fix. We received instant gratification when we resorted to sex that masked what we believed was lacking in our lives. Subconsciously, we knew that these behaviors were increasing our core of shame and unworthiness. This cycle drove us to seek others to use sexually, to relieve our continual need for affirmation. The more we relied on this temporary infusion of validation, the less worthy and more incomplete we felt.